Hello there, how are you? I believe by now you've been flowing with us in this beautiful series on nursing care plan, and our previous session was actually on the steps of creating a proper nursing care plan. So if you're new in our channel, this is Medic Academy, where we focus on health-related units, topics, interviews, and real-life experiences that pertains all matters of health. So keep up with us. Thank you so much for those who've been following the series, and for those who don't know me, my name is Winnie Barawa. Today's class, I want to focus more on goal and outcome. So I want to understand in our steps, there's that place where we say there's a moment where we'll develop a goal and an outcome in the nursing care plan. And I realize that some people who struggle a lot on how to state a goal, or when they're stating the goal in the care plan, sometimes it doesn't come out clearly because they do not know how to put it clear, or they don't know which tips they need to understand around it. So this class is going to focus purely on that area where we are setting our goal or our plan, so that when you're putting it in place next time, you're going to do it better. So flow with me and let's enjoy our class. So I recap goals and outcomes. Goals basically describe what the nurse is hoping to achieve while we are implementing the nursing care. And the goals we set in our nursing care plan are guided by the nursing diagnosis that we have generated in the care plan. That is after we have assessed the patient and we have understood what are their priority needs. We've put our nursing diagnosis in their priority order. And the second thing to do is now, which goal or plan am I looking at that I will achieve by the end of administering my nursing care? So in this case, you're always advised, ensure the goals are SMART. This is still a recap of our previous series. So for those who've not watched, you can watch the video on 9 steps on how to write a proper nursing care plan. So the goals we stated before that you need to ensure your goals are SMART. By SMART, we mean should be specific, measurable, attainable, realistic, and time-bound. And this is the place I want us to go deeper, so that when you're generating it, are you sure your goal is smart enough, and does it carry the required nature and weight of a nursing care goal the way it's supposed to be? So remember, the goal has to be smart, but now we want to implement this smartness in required nature. So recap again, we said goals can be two. You have the short-term goal and you have the long-term goal. So the short-term goal, this is the nursing care goal that you're achieving or you're expecting to immediately achieve it. Mostly it's targeted for like few hours or days. Doesn't take long for it to be fruited. It's very short-term. Well, the long-term nursing care goal is the objective that takes long periods. That is in terms of like weeks or even months. So most patients care when they start hitting days or of weeks, such as 6 weeks, 13 weeks. We start talking of long-term goals. So in this case, you need to remember also when you are writing that nursing care plan, most of the time our minds thinks of just the 24 hours that we are generating that nursing care plan. But remember, your nursing care goal section is not thinking of just 24 hours. You need to open it up and know that as much as your nursing care plan is operating for 24 hours, the goal or the objectives might be achieved, whether could be 2 hours, days, or even could be month. So in short, you don't have to be restricted in time when it comes to stating the goal of your nursing care plan. And you don't need to restrict yourself to just 24 hours. Remember, we have said the goal can also be time bound. So that time, it is spread out. It doesn't need to be within the 24 hours only. So here are the key areas now that I want us to focus on. So we are mentioning that this goal and outcome needs to be SMART, but there are components of it that will make it SMART. And these are the components I want you to listen very, very carefully. And one of these components is the subject. So when you're writing the goal, whether a student or a professional, sometimes you might be tempted to write in the essence of the nurse. So you may be tempted to state it like the nurse expects to do this and this after this period of time, but you're being told that the goal has to be in the client. It should be reflecting the clients. Like you do not write it in the name of the nurse. So in this case, you're being told the goal needs to reflect the subject, okay? And the subject in this case is the client. And who is the client? The patient. So you will not be writing a goal reflecting to yourself as your hard work, like I expect to do this and this by the end of this. No. We're expecting you to tell us what will the client demonstrate or achieve after a particular period of time. However, these subject areas that you are relating to, we need to state the need of that patient that will be changing. So for example, the pulse or the temperature or the urinary output, is it mobility and so on, depending on the needs that you identified. So we'll use an example later on so that we can expound on this, but you just need to remember your goal needs to be more focused on the client, that is the patient. And by the client, we mean the needs of this patient that you had identified. So is it lack of enough oxygen? Did you identify the need of nutrition is low? Did you identify maybe the patient has high temperatures? Now, what are you expecting to change from these observations that you've made? So in this case, you'll be stating them in relation to the client, or rather in relation to the subject. Number 2, your goal will have a verb. So the verb will be reflecting the action that your patient will be able to perform, or it will be reflecting the action that will come out after a patient has achieved certain goals or certain targets that have been set by either the doctor, the nurse, or just the general medical team in the particular area that you're working in. So keep note, you will need a verb. The other component, the goal will have conditions or modifiers. Modifiers are the acts that will be explaining the verb. So for example, if the action is that the patient will demonstrate ability to ambulate independently, then the modifier or the action is that activity of ambulation. So this is the state of condition that will change when this patient has achieved the objective. But like I said, be patient here because we are going to demonstrate to you exactly how this verb should, how this outcome should look on your care plan. And lastly, we need a criteria of desired performance. So here we will be indicating the standard to which the client will perform in that particular behavior. Is it performing independently? Is the patient performing with assistance? If it is congested chest, is the chest clear and patient is able to breathe off oxygen? Those are criteria of the desired performance. So there is that which you wish your patient to do where they don't need your assistance as much. So when you talk about criteria of the desired performance, we are talking about ability of this patient to be free from the dependence so that they can do it on their own, but to which caliber. So now as we move on, we are seeing that the goal needs how many parts? 4. The subject, the verb, conditional modifiers, and then we have the criteria. So I want us to put these parts into a sentence that will demonstrate what will qualify to be an outcome. Patient who is an orthopedic patient possibly has been on assistive devices, and this is crutches. So this is a nurse who is stating a goal in anticipation for the patient to improve. So the goal, like we said, needs a subject, and who is this subject? The client. Some nurses are good in identification, so you may write the client's name. So let's say the client is John, then you can say John, okay, which is allowed. You can also write the client, it's allowed, it's fine because the file is already indicated. But I tell people go the extra mile if you can and just put the details as exact. This will bring in specificity because client is a general statement, but if you just write John in reference to the exact patient that you're talking to, that will make your goal very specific. So John, for example, will ambulate. Now ambulation is a verb. So this is the verb that we're talking about. and this is the goal the nurse expects John to do. So John will ambulate. But now, what are the conditions of ambulation that this John will demonstrate, and at which standard? So John will ambulate unassisted with crutches. So the nurse is anticipating John ambulating without assistance, So in this case, you are stating the conditions or the changes that John will demonstrate. There will be ambulation, but to support this ambulation, you are describing it further by telling us in which state, so unassisted, which is very good. And now there's the criteria. Which standard? Standard can be in terms of time. Standard can also be in terms of the level of independence achieved by your patient. So now this criteria here is using time. So the nurse states by discharge time. So in this case, he's anticipating John will ambulate unassisted with crutches by discharge. Now if you look at discharge is general, but it could also refer either to a long-term or short-term based on the expected date of discharge of this client. So I hope by now you're getting how you can state your goals without confusing yourself. So there's a subject in it, there's a verb, there's conditions or modifiers, and then you have the criteria. So at no given time should you forget. But at the end of the it, assess your goal and confirm that it acquires the characteristics of SMART. SMART means, is it specific? Is it measurable? Does it look attainable? Okay. Is it realistic, and is it time bound? When you see those coming together and all the components are in place, then you're sure you've achieved your purpose. To bring this to an end, then let's look at a few tips that you can incorporate as we keep writing this outcome. So like you said, the goals have to come in terms of the client responses and not the activities of the nurse. So this I think we have emphasized more. So like here you said clients will, or John will, Mary will. Talk in the name of the patients. Do not introduce your name there. Don't start saying the nurse will demonstrate. No, it's the client that needs to demonstrate. So bring in client will or John will. Like we said, if you can bring the name of the patient, well and good, which is the best way to handle it actually. And then focus. So this is a good repeat. Focus on what the client will do, not what the nurse will do. And then again, we are saying use observable, measurable times for the outcomes and avoid using vague words or general words. Like example of the name client here, which is a bit general. Just if you can go specific, better. If you can demonstrate using words that are strong and clear, like ambulate, walk, jump, those are specific words, which also makes it clearer. And the last part is on desired outcome should be realistic, which is also stated this, that make it realistic, make it look like within the time bound that you're giving us, this thing can be realized or attained. Don't give time spans that do not make sense. For example, someone can state a state whereby a patient is from theater, they're like 1 hour post-surgery, and they start saying, Mary will demonstrate a pain scale of 2 after 1 hour. That will not make sense because post-surgical wounds do not have a pain scale that drops from 10 to 2 in an hour. You need to give us reasonable pain scales, or rather be realistic even as you're stating your time bounds and as you're stating your expected changes. Then ensure that your goals are compatible with therapies of other professionals. Yes, you will not be working alone, you'll be working with other people. So ensure that as you bring in your therapy, at least you bring in your goals, ensure that you've incorporated also the work of other professionals in your work. And give each goal from one nursing diagnosis. Generate at least one goal per each nursing diagnosis. Another example to just support our learning. For example, here is a cardiac output patient who has heart failure. Says the client will demonstrate adequate cardiac output as evidenced by vital signs within acceptable limits. Again, if you can be specific with the vitals, please do. Give us the blood pressure, tell us the pulse, tell us the SpO2s if you can have them. That will give more specificity. And then it says there will also be evidence of absence of dysarrhythmias and no symptoms of heart failure. This is good. However, there is no time bound. I wish there was a time bound to make it more stronger. Then the other part is of a patient who has ineffective air clearance due to pneumonia. So this one says after 8 hours of nursing intervention, the patient will display signs of effective airway clearance as evidenced by absence of dyspnea, cyanosis, and respiratory rate within 12 to 16 breaths per minute. This is also good. There's more observed here than the previous one of cardiac output. So yes, when you're dealing with goals and outcomes, just apply the simple rules. Focus on the patient. So your goal should have components of the subject, who is the client, the verb, the modifiers, and have finally your condition that you expect to change at the end of the day. So in this case, ensure that your goal at least also achieved the criteria of smartness, so that you're covering each and every part of it. So that's it, guys, on goal and outcome. So if you find this series very helpful to you, don't hesitate to share with your community or to share with your friends or classmates or also fellow health workers, and come and like and subscribe to our channel. And that's it for the day, guys. Thank you very much, and see you in our next class.